Good afternoon and welcome to our press briefing. I'm Monica Hendrickson, the Public Health Administrator for Peoria City County Health Department. And thank you for coming to our briefing related to the formula shortages that we are seeing nationally and how it's impacting our families here in Central Illinois. We have two speakers. The first up is our pediatrician from OSF Medical Group, Dr. Terry Ho. Dr. Ho will be discussing a lot of the impacts of making sure that individuals are utilizing formula effectively and safely. And then following that will be Peoria City County Health Department's Child and Family Health Program Coordinator, Michelle Compton, who will be speaking on our Wic program as well as options for families in our area. So with that, I'll turn it over to Dr. Ho.
Thank you for having me, Monica. I wanted to be able to be here today to be able to talk to you guys and answer some questions that we've been receiving as a pediatrician regarding the formula shortage. As a pediatrician, our job is to help guide parents, families about the health and health of their children, and part of that includes their diet and their nutrition. And recently, with the formula shortages, we've just run into what we consider a perfect storm of issues that have led to these problems that we're at today. Whether it's possible concerns for bacterial contamination at an Abbott factory, in addition to supply chain issues, we're seeing it hit close to home where a lot of our families and parents are calling and contacting us with questions about what to do and how to feed their child. So I wanted to share some of those questions and hopefully answer some of those questions that to everyone out there. So one of the big questions we're getting from families is it okay to stretch out my formula supply? So one of the thoughts is that if I add more water to my formula, I might be able to drag that supply that I have out. We really want to recommend against doing that. The main reason why is by watering down that formula, you're changing the nutritional composition of the formula. And we know that that can actually lead to some other harmful issues in your child. So try not to do that, actually don't do that, and make the formula per the recipe that's on the can or from your pediatrician. Another big question that we're getting is about the recipes that that families are getting off of social media and getting passed around. We're seeing a lot of families question and ask us about making their own formulas from home. And what we know is that that can also be very, very dangerous. So formula is a complex combination of fats, proteins, vitamins, and minerals that you likely are not going to be able to recreate at home. In addition to that, by making your own formula, you also run the risk of bacterial contamination, which is one of the main issues about why we're in this place in the first place. So we really recommend against looking at using those recipes. I know that you may get recommendations from somebody, a grandparent that said that this is how we did it back then, but what we know is that the formula is tried and true, and there's benefits to getting the canned formula that hopefully we'll be able to get to again. Also getting questions from families about the specialty formulas. If you go down the formula aisle, normally there's all kinds of different formulas, and it can get confusing for a parent to know how to feed their baby and which formulas to use. And so the specialty formulas are made for specific situations and for certain health situations. So we really want to recommend families to contact your pediatrician, contact us if you had a question about maybe a formula that you had access to. So there are certain newborns, infants, kids out there that need that specific formula, and so we don't want you to feel like to jump to that if another child actually medically needs that formula. So talk to us first if you had a question about that. We're seeing some new information about imported formulas, and so for a while now, a lot of families will seek out formulas from other countries and try to get formulas from other sources. I believe just recently there's going to be an FDA push to be able to have quicker access to some of those formulas, but again, if you had a question about that, direct them to us. And also, as you're looking for those formulas, I really recommend trying to buy them from a reputable source. Unfortunately, in a time like this, and what we've seen during the pandemic is there are people out there that are trying to feed on your concerns and on these issues, so reach out to us if you have those questions. Another question that we are getting is about toddler formula and even regular cow's milk. There are kids who, infants who, as they get older, may be candidates to be able to start toddler formula or even start whole milk a little bit earlier. We don't want to recommend families just do that on your own because not every child will be ready to handle that, and some children won't be able to take that at all. So reach out to your pediatrician if you had those questions and you had those concerns. We know this is a very trying time, and for a lot of parents, as we've gotten through the pandemic, now having to deal with this, it can be extra stressful. But as a pediatrician, we want to be able to be there for you to help guide you through this health concern as well. So reach out to your doctors, reach out to your pediatricians, and we'll be there for you guys to help you through this feeding concern. Thank you. Oh, absolutely. What we're seeing locally is that there are options. There are options to get formula. You may have to reach out to stores, vendors that you hadn't thought about in the past. I know that, a lot of people have their routines and patterns of buying and shopping, but, we recommend seeking out, your drugstores or smaller businesses. And even for those families that have that option, even looking online, big box retailers are also options. And I guess one thing I didn't stress earlier was that, as much as we were talking about, I talked a little bit about the specialty formulas for certain kids. For a majority of children, they can take any formula. And I know a lot of families find a formula that works for their child early on and would like to stay with that formula throughout their infant period. But the reality is, for most kids, they should be able to switch without any issues. And so although it may not be the formula that your child is used to, it could be a formula that they can take without any problems. We just have to be comfortable trying that.
So it's okay to get a different formula as long as it's not one of the specialty formulas?
Absolutely. And even in certain situations, if we're stuck, a specialty formula may work for you as well. We do, though, want to try to reserve those for, again, those children that may medically actually need that. So if you had a question between this and that, I would hope just reach out to us. We can help guide you through it. I've been getting a lot of questions about, I found this, is that okay to give for my kid? Or, what about this option? Do you think this would be okay? We're hoping this is all temporary. And so for a small period of time, it shouldn't be an issue. But again, if you wanted guidance through that, we could help you. There are other questions?
How bad is the shortage? I mean, is it a situation where, you go to Walmart and you can't find it, but you go to Kroger and you can? I mean, does it just mean that parents are having to hop all over the place, or is it that they go out and they just cannot find it?
Just last week, I was wondering the same. My children are a little bit older, so we're not stuck in that situation, luckily for us. But at the same time, I wanted to see what families are going through. So just searching online, which is, it's a nice benefit for us these days, is you can do a lot of your shopping online, and you can look. And so just looking in, the Tri-County area, I was able to find different forms of different formulas at different stores all throughout the area. Now, that may mean for somebody in Peoria driving out to Morton, or that may mean someone from Washington coming into Peoria. But we were able to find it at different grocery stores, and it's one of the benefits, again, of doing some, online shopping, so that you can check your Kroger's and Hy-Vee's and check Target and check Walmart before you even head out of your house. And, you could probably even put that order in and just pick it up as you get there. But I did find, as of last week, a good amount of different types of formulas throughout the region and the area. Thank you.
Good afternoon. I am Michelle Compton, the Child and Family Health Program Coordinator at Peoria City County Health Department, and I'm here today to talk about the status and the impact for our WIC office locally. So I just want to clarify a little bit about the WIC program. WIC is a special supplemental nutrition program for women, infants, and children. We provide formula along with nutritious foods and nutrition education to WIC eligible families. To find out if you're WIC eligible, you can go on the Peoria City County Health Department website and the WIC page to see our income guidelines. WIC offices are not able to keep formula on hand, so I like to mention that. So a person's not able to come to our office and leave with formula in hand. The way that it works is we load formula onto an EBT card for that participant to purchase at the store. If you do have additional formula to donate, again, we're not able to keep it on hand here, so we recommend that you find a local community organization to donate that formula to. Each state WIC program has a contract with specific formulas and specific sizes. So the type of formula that we're able to put onto the EBT card depends on that contract that we have. Here in Illinois, our primary contract formulas are Infamil brand. We do have a few specialty Similac products that we are able to provide. Our local WIC offices are working with our state vendor relations program to let them know about the shortage impacts here so that they can work with the vendors and try to locate formula when possible. If you are not able to locate formula, as Dr. Ho previously mentioned, we're finding that if people are able and willing to travel a little bit further, they're usually able to locate that formula. It might mean traveling to a far end of the county or even out of the county. But I would recommend that people anticipate having to spend a little more time looking and traveling for that formula. And then still, if you're not able to find it, if you are a WIC participant, we strongly encourage you to contact the WIC office. We may have received information from other participants. A lot of times somebody will call us and let us know, hey, the Walmart had full shelves of formula today, so we can share that with you. Additionally, we can share that information with the state to let them know the severity of the shortage. And then additionally, just talking to your pediatrician about other options. WIC has a number of options. So if you are a WIC participant and you typically receive a specific formula, we are able to switch you to a different formula if necessary. What we recommend avoiding would be any stockpiling of formula. We really encourage parents to try to only get what you need at the time. And I realize that this is a scary time. If you are stockpiling formula or having several weeks or months worth of formula, that is formula that's sitting in a pantry that could really be used by a child that needs it that day. So we really discourage people from stockpiling or buying excessive amounts of formula. And then as previously mentioned, we recommend avoiding any type of homemade formula or alternatives such as cow's milk, goat's milk, or other milk products. What you can do to help, if you are not a WIC participant, since WIC is very specific in what participants can purchase, we encourage looking at other brands. So there are plenty of store brand formulas available that typically are the exact same ingredients. So talking with your pediatrician, comparing the labels, and you may be able to find a store brand that's almost the same product. And then looking at the sizes. So at most grocery stores, they have a small tag that says WIC approved, and you'll see that's typically the smaller cans. If you are not a WIC participant and you find a larger can, you purchasing that larger can frees up that smaller can for the WIC participant that might need that smaller can. Another way to help is breastfeeding. So I want to acknowledge that breastfeeding is not the right choice for everyone. There are medical reasons and personal reasons that people do choose not to breastfeed, and that is perfectly fine. If you are a pregnant person or have a child at home and you are breastfeeding or considering breastfeeding, we strongly recommend considering this as an option. The American Academy of Pediatrics recommends providing breast milk for at least 1 year. This recommendation is based on evidence that breast milk protects against a number of diseases, both for baby and for mom. There are lots of breastfeeding supports in the area. There are IBCLCs, both private practice and hospital-based, as well as breastfeeding peer counselors and certified lactation counselors at WIC. So if you are pregnant and considering breastfeeding, or if you're a breastfeeding parent who needs support, please reach out and know that we are here and happy to help you reach those goals so that you don't have to go through the stress of trying to find that formula. And then another option I just wanted to talk about was donor milk. So we are fortunate here in Peoria County. We serve as a milk depot. That means that we work with a milk bank to be able to accept donor breast milk if a parent is producing more milk than they need. With that breast milk, we send it to the milk bank where it is pasteurized for safety and then provided to infants who need it. So if you are a parent who has extra milk that you would like to donate, you can contact us at the Peoria City County Health Department or the Mother's Milk Bank of the Western Great Lakes. Additionally, if you feel that your child could benefit from receiving donor milk, you can also reach out to Peoria City County Health Department or the Mother's Milk Bank of the Western Great Lakes. And then just kind of a positive note to end, we do hear that production is beginning to increase. Our local agency WIC offices are in constant communication with the state WIC director, and after talking with her, she reported back Meade Johnson has increased their production by about 60% compared to in February before the recall. And then the Abbott plant in Michigan has recently announced that they are expected to reopen within the next few weeks. So we should see those effects trickle down shortly after. And then more recently, I believe it was yesterday, the Biden administration did release 2 actions that they're going to be taking to increase access. In the meantime, there are a lot of local community resources that are excellent. I would recommend contacting 211, which can connect you with resources that may have formula. We also have our Crittenton Crisis Nursery, who I've talked with them frequently in the past few weeks, and they do have formula that they are happy to donate to people. So again, you can look for community resources or contact 211 to be connected with those. Thank you. Any questions from anyone?
Do we know if the state is in talks with vendors to possibly expand access to different brands or different sizes of formula as well?
For WIC participants specifically, they are in contact with them. It's a process. So when an item is WIC approved, they have to change the UPC codes at the store and all of that. And there is a contract in place, so they'd have to revise that contract. So they're looking at what's available, how long until it's available, to see which would be quicker. If by the time they went through that, it would be available anyway. So they definitely are in contact, though. All right, thank you very much.
Well, I'll take any questions before we end the briefing for today.
What is your sense on how bad this is? Are we getting a lot of calls at the health department about this, or?
So the question is the sense that we have about how nervous or how bad the situation is with formula. I think it's a relative to what Dr. Ho said, as well as what our coordinator Michelle Compton stated. It's not the default easy option anymore. And I also think we're talking about a very protected group of individuals, right? New moms, young families, as well as infants. And so I think there's a lot of stressors in that situation to begin with, but then to add a concern about being able to provide nutrition to infants, adds a different layer. So again, I think the key is 2 things you can do is, 1, have patience. Your default setting for how you're going to be accessing formula or other types of services like this may not be the easy button as it was prior. And then also, what we even talked about 2 years ago, which is do not stockpile. I think Michelle said it great, which is the formula that's sitting in your pantry could have been used for a child today. So again, very much try not to stockpile. Get what you need and make sure there's enough for others.
Like everything else, it's going to hit poor people harder. I mean, people with money can afford to drive from store to store looking. What about these women who don't have cars, and, it's a big deal.
So the question is related to the inequity that it kind of creates by having to look at different transportation mechanisms and the difficulty that it will have a disproportionate impact to low-income individuals. So first and foremost, that's why we really wanted to focus on our WIC program. Our WIC program supports individuals. It's an income-based program to help them get access to nutritional food as well as formula. And so again, if you are an individual that has the means to purchase things, try to stay away from those WIC labels. Just like we said about 2 years ago with cereals, even when there was stockpiling, if you have the option to not buy WIC, don't buy WIC. Save that for individuals that are on our program, and they are on that program because of their income level. So we want to make sure we have equitable access to formula so that every infant has a fighting chance here. Okay. Well, again, thank you very much. Appreciate you guys coming in.